video, we are going to learn about homeopathic treatment for dental abscesses, their complications and types. Before discussing homeopathic treatment, I would like to share a few important things with you. What I have learned in my practice, I will be sharing with you. I hope it will help you in your practice as well. When we treat dental abscesses, we must have a thorough knowledge and understanding of their complications. This knowledge will guide us in the selection of proper remedy and in stopping the progression of the disease. So let us learn about the complications. What happens if the dental abscess is left untreated? The first complication is the loss of the tooth. The untreated dental abscess won't go by itself without proper treatment. If the abscess ruptures, the pain may improve a lot and it may seem like the problem has resolved. But the patient still needs to receive the proper treatment, otherwise the patient may lose their teeth. The next complication is the abscess may spread to the surrounding areas like head, neck, bones, lungs, heart also, and it may cause further complications like osteomyelitis, abscess in the brain, pneumonia, inflammation of heart, etc. So it is important not to ignore the symptoms. Being vigilant about patient's health is fundamental in preventing such a complications. The next complication is dental fistula. The untreated dental abscess can last for months or even years, damaging the surrounding bones and teeth. And sometimes a narrow tunnel is formed through the bones and the skin to allow the pus to drain. This is called dental fistula. Next is sepsis or septicemia. If along with dental abscess, if the patient has high grade fever, chills, headache, rapid pulse rate, rapid heart rate, dizziness, these are all the symptoms of septicemia. It means the bacterial infection has spread inside the body through the bloodstream. The bacteria can also enter the body through the gum line or any break in the gum. The next complication is Ludwig's angina. It is a life-threatening infection, a type of cellulitis of the soft tissues involving the floor of the mouth and the neck. It is rapidly progressive, leading to potential airway obstruction. So we must understand the seriousness of this disease. It is rapidly progressive, intensely painful also. The symptoms are pain in mouth, swelling of tongue, difficulty in breathing, difficulty in swallowing, soreness of throat, hoarseness of voice, drooling also, etc. These are few symptoms. And when we treat Ludwig's angina, we have to be more alert and constantly in touch with the patient. We have to take follow-ups every 3 hours or 4 hours frequently, knowing the seriousness of this disease. So this is all about complications. The next is types of abscesses. We must know which type of abscesses we are treating in our clinic. This is also important. There are 4 types of dental abscesses: periapical, periodontal, gingival and pericoronal abscess. So out of these 4 abscesses, the periapical abscess, which form in the tooth, in the pulp of the tooth at the root of the tooth, and it is associated with cavities in the tooth. The other 3 abscesses, pericoronal, gingival and periodontal abscess, form in the gum, not in the tooth, but in the gum. So it is seen in my practice that the abscess which form in the gum are easy to treat and they go away easily with homeopathic treatment. But the abscess which form in the tooth, means in cases of periapical abscesses, they are difficult to treat sometimes and they won't go away easily. and the reason is presence of cavities in the tooth. It happens sometimes. In some cases, it is seen that despite receiving the best treatment, the abscess may not go away. The pain disappears, pain in the gum, pain in the tooth disappears, fever also disappears, but a small amount of abscess may still remain. So in such a cases, when we see that the patient is improving with our homeopathic treatment, his pain is decreased, fever is gone. So at that point, we should refer the patient to the dentist to fill the cavities. Otherwise, bacteria will keep invading the cavities and pus formation will persist there. So it is important in cases of periapical abscesses to fill the cavities. Cavities are like maintaining cause in cases of dental abscesses. And unless and until we remove the maintaining cause, we cannot cure the patient completely. This is my experience in my practice. And sometimes we have to use higher potencies like 1 m, 10 m in cases of periapical abscesses. They don't go away easily. Let me know about your experiences in your practice in the comment section. This is about complications and types of abscesses. The next part is homeopathic treatment for dental abscesses. Homeopathy has a wide scope in dentistry. Almost every non-surgical and few surgical dental problems can be easily treated with homeopathic treatment. Homeopathic treatment makes the entire procedure very comfortable and peaceful for the patient as well as for the dentist. By relieving the inflammations, toothache, hemorrhages, and also anticipatory anxieties in patient. Some patients have fear of dentist, fear of sharp instruments. In such cases also homeopathy is very helpful. There are few important remedies I want to share with you for dental abscess. The first is myristica sebifera. This is very important remedy in cases of abscess and suppurations. A remedy of great antiseptic power. It hastens the suppurations and shortens its duration, and acts more powerfully than Hippar and Silesia. It is written in Boerick Materia Medica. If you open Boerick Materia Medica, you will find there, and very useful in cases of phlegmonous inflammation. What is meant by phlegmonous inflammation? There is a difference between phlegmon and abscess. In abscess, the lesion is localized. It has specific boundaries, encapsulated and circumscribed. But the lesion of phlegmon is not encapsulated. It does not have specific boundaries. The phlegmonous inflammation is a purulent inflammatory process characterized by tissue necrosis and absence of capsules of the lesion. And that is why the phlegmonous inflammation spreads along the tissue plane and through tissue spaces. As the inflammation progresses, it involves the surrounding structures like connective tissues, adipose tissues, muscles, fibers, and it goes on spreading. In contrast to the abscess, rapidly progressive plus intensely painful, and swelling is also very intense in cases of phlegmonous inflammation. The typical example of phlegmonous inflammation is Ludwig's angina. Ludwig's angina is also called phlegmon of the neck. If we understand the pathology of Ludwig's angina, we can understand phlegmonous inflammation. What happens in Ludwig's angina? It is a type of cellulitis of soft tissues involving the floor of the mouth and neck. And as the inflammation progresses, it involves the surrounding structures. The inflammation is very progressive, rapidly progressive, and swelling is also very progressive. Intense swelling is there which cut off the airways. And due to swelling, the breathing is difficult. Patient cannot breathe properly, and that is why it is life threatening. When we treat Ludwig's angina, we must not forget myristica sebifera. It is very useful remedy in all cases of suppuration, especially dental abscesses. With the help of this remedy, we can save the life of the patient. If not treated immediately, it is a life-threatening condition and may cause death. Ludwig's angina. The next remedy is hekla lava. It is made from volcanic ash and it has a marked action on bones in general, especially on jaw bones, mandible, maxilla also, and mastoid bone also. Very useful in cases of dental caries, abscess from dental caries, neuralgia from dental caries, neuralgia after tooth extraction, swelling of jaw, swelling of gums, which is very sensitive to touch and pressure. It has a marked action to arrest all forms of bone diseases and hence very useful in cases of dental fistula also. It arrests all forms of dental problems and bones problem like necrosis, inflammation of bones, tumors of bones, difficult dentition in children, in scrofulous children. Mind symptoms are also important in hekla lava, sensitive to criticism, sensitive to indignation, violent outburst of anger there. It is an angry remedy. Suppression of anger also there. The anger is very violent, just like volcano. How volcano burst with that intensity, there is outburst of anger. Elements from shock, a sense of helplessness is also there in hekla lava. Next remedies are, I want to share few remedies for septicemia due to dental abscess. First is Merck salt, pyrogen, lachesis, echinacea. These are few important remedies and they have marked action on blood, sphere of action. I found Merck salt very useful in my practice when the general symptoms are matched along with mouth symptoms. The mouth symptoms are spongy gums, easily bleeding gums, dental abscesses, abscess at the root of the teeth, and increased salivary secretion. Saliva is viscid and very foul smelling. The symptoms of Merck salt are aggravated at night time, mostly evening and night time. Increased thirst for chilled water. Coppery sweetish taste inside the mouth, in the mouth. Then generals are very important. All the secretions are very profuse and foul smelling, including saliva and perspiration. Perspiration does not relieve the symptoms. Symptoms are aggravated during perspiration. Aggravation from warmth of bed, aggravation in humid wet weather, aggravation by lying on right side. And very useful in cases of septicemia when the lymph nodes are enlarged. Merck salt has marked action on lymphatic system. The next is pyrogen, useful in septic fevers, chilliness, coldness, chill begins in the back, rapid increase in temperature, rapid pulse rate, always out of proportion to the temperature, profuse sweating, but sweating does not cause fall in temperature. Then foul smelling excretions, horribly foul, sweat, saliva, urine, all the secretions are very foul in pyrogen. Loud heartbeats, palpitations, and consciousness of heart with fever. These are few symptoms of pyrogen. With homeopathy, we can give excellent results in cases of dental abscesses. If the simillimum is prescribed at right time with right diagnosis, we can arrest the progression of disease, their complications, and cure them successfully. I hope this video will help you in your practice. See you soon. Thank you. If you have any query, you can drop in comment section.